All right, so we'll start with the first question. Where were you raised?
So I was raised in California in the Central Valley, which is a heavy agricultural area.
Okay.
And then I moved to Oklahoma about 3 years ago.
Okay. Could you begin by telling us about your own relationship to the AI and disability community?
So I've been in the field of mental health primarily, for more than 20 years. Started volunteering at community service centers for people with various disabilities related to mental health and substance abuse, cognitive, as well as some physical handicaps. I've done that over the years. I've been affiliated with a number of nonprofits that provide services or resources or linkages for those similar categories. And over the last 7 years, I've been really heavily entrenched, not only in mental health, because that's what I do for a living, but really entrenched in the intellectual and developmental disabilities world. And that's because of my son. My son is 7, he is autistic, and just trying to get him services and navigate, the complexities. And one of the things I discovered, immediately is having all the resources I have, having private insurance, having, education and formal training and all of those things. And it was so hard to navigate a broken system. And so I cannot even imagine what somebody tries to go through without any of those things that I just named. And so because of that, it's really important for me to fix what I can and to advocate for change and for inclusion and for listening to the voices of those walking the journeys.
I see. Well, yeah, you have all these resources, and how are you supposed to?
I had barrier after barrier. And so I'm just thinking about, for myself, my son went through his diagnosis process right before he turned 2. And I knew, early on, probably about 12 months old, I started seeing things that I knew were related to developmental disability. And the problem that I had going through his first evaluation, again, knowing what I know, doing what I do, at the time of that evaluation, I was a psychologist, practicing and doing all these things. And the person who was a pediatric psychologist brought me in the room and spent 45 minutes with my son and I, and really didn't do anything, at all. Asked a couple of questions about pregnancy, asked a couple of questions about just like his play and talking and those kinds of things, and really didn't use any instruments, didn't attempt to use any instruments, didn't do very much. And basically they came back and I said, okay, we're finished. And I said, you didn't do anything. And we went round and round, and finally I said, well, you have a Vineland in your bag. I can see it right there. And she goes, well, how do you know what that is? And I said, so did you not read the packet? Because if you did, you'd realize that I actually do evals too. And I'm not a pediatric. I wasn't a pediatric practitioner, but I did see children who were victims of crime. And they also had developmental and intellectual disabilities. And so that just told me again, how much people who don't know better, how much they go through, when they don't have the training or the connections or the resource or even the insurance coverage, how much harder it is for them to get the answers and to get help is just disturbing.
It is, and that's what I've been noticing as we're going through this toolkit. Is just like you said, it feels like barrier after barrier. So let's go ahead and move on to the next question. And joined us is my Robin, who's also helping with the project.
Okay. Perfect.
So the next question is, does your tribal government have a law or resolution that prohibits discrimination against people with disabilities and requires equal opportunities for people with disabilities?
They do. It's pretty similar to federal,
okay.
in regards to.
Oh, And what were the key elements or factors that convinced this tribe to develop tribal laws, ordinance, or codes to protect them?
Honestly, I think it was so long ago. And my best guess, just because I mean, it was before, I was an adult. I think a lot of it was just driven off of equality and inclusion principles and the principle of community, because our tribe is very community focused and helping where we can. And I think a lot of their laws are just historically and even now modeled more after federal.
Okay. All right, let's go to the next question. How does your tribe address support services for persons with disabilities and their families, such as home support programs, respite coverage for parents, personal care attendants, and other caregivers?
Not very well. I don't think I've met any tribes that actually do it very well. And that's just a reflection of resources, just it's just so overburdened. The system is just so overburdened. There's just a limited amount of funding and resources, and it's just fragmented, if you will. I would just say pretty fragmented. And that's one piece. And the other piece is that there's just a huge disconnect between people understanding what they could ask for. You don't know what you need if you've never been in the situation. And if you don't have access to that knowledge or those resources, how would you know that you're missing them? How would you know they even exist? So.
Okay, let's go ahead and move on to the next question. What are the major barriers for people with disabilities on your reservation?
I think geographical kind of barriers of transportation, spread out, or it's either spread out or concentrated in one location, and the land is so vast, right? The other thing is just a limited amount of resource available in segmented kind of things. And then lastly is just back to what I said, is just the lack of insight into what you actually could use or what you're actually afforded. If somebody doesn't know how to advocate for their own service because they don't know what the service is or even that they need it, how would they even know where to get it? So I think if we did a better job of making it available, right? Making it tailored to the community, the respective communities, removing those transportation and geographical kind of issues. And then the other piece would really be disseminating that information of what it is, how to get it. It's here for you. We're here, and making it really kind of embracing of people, rather than you have to know the secret in order to get the secret. And so it's kind of, I attended this training one time, and it was called the poverty of disability. And basically what it means is, it's not literal. What it means is, in order to get the resource, you have to have the resource. So if you don't, like, for example, the advocacy, the knowledge, the information, the connections, the transportation, a phone, internet, whatever it is, you have to have a resource to get a resource. And without that, you just stay in this vicious cycle of lacking. So you have to have a resource to get a resource, and that's a broken system. Because if you had the resource, you wouldn't need the resource.
Mm-hmm. Wow. Where did you hear that?
It was a training in New York. I went to a webinar, and it was literally called The Poverty of Disability. That was like the title of it. And it was a webinar, and it was basically talking about all the barriers that are put into place, and you have to have a resource to obtain a resource, which defeats the point of needing the resource and getting the resource. And so without the resource, you can't obtain the resource. Therefore, you're just stuck over here without anything. And so that was kind of like, it was just one of those topics. It was just really powerful. It was put on by disabled individuals of various types. And they were just talking about like the barriers that they have hit over and over, whether it was stigma, transportation, communication, discrimination, whatever, and how it was just, how do you know you need this thing, number one, if you don't know what you need, and how do you obtain this thing if you don't have the thing over here to connect you to the thing? So
Wow. Yeah, I'll have to look into that. That sounds
yeah.
interesting. So we'll go ahead and move to the next question. What are the barriers to healthcare experienced by people with disabilities in your tribal community?
So I think it's just the same thing as one is the lack of understanding. Um, but also too, there's still a lot of shame and stigma, and people not wanting to take it outside of circles and outside of families and outside of communities. There's a lot of fragmented services and a tremendous amount of barriers to care. We're seeing some of that change with some of the federal funding that's coming down and some of the new mandates and partnerships. We're seeing a lot of that change where, you know, tribes are really becoming empowered to provide care for themselves and kind of take on that mission. And so we have seen significant changes this year, even, you know, my tribe investing $30 million into mental health, investing, I think it was $70 million into early childhood centers. And that's because they know that these screenings need to happen. These, you know, communities need to happen. This support needs to happen. It needs to be okay to reach out and say, I don't know what I'm doing, please help me. Or to make things where they are accessible. So there's a huge, my tribe's a huge broadband mission to get internet out to the far corners and to all the places so that they can have appointments online, so that they can connect with others, so they're not alone, you know. So there's just a lot that has been going on over the years, but more so I say this year.
I see. Yeah, as we're talking, I'm starting to see that some of these questions kind of overlap with one another.
Yeah.
So I'll just move along.
Yeah, no worries.
So the next question is, are children with disabilities treated differently in your school systems? Please describe.
I think oftentimes children are treated differently in school systems, and I'll just use my son as an example. It's because there's a lack of understanding, and then the media does nobody any favors. They always go the extremes, right? When they show them on TV shows or whatever. And so it sets up this false narrative of how to include somebody and what to expect from, and we approach people with disabilities from a disability lens instead of their opportunities and abilities and wondrous gifts that they have. You know, we see the deficit instead of the asset of all the things that they are capable of, that they can do. And I think that's one thing that you see it in children, you see it in teachers, you see it in systems, is just that lack of true understanding and true inclusion and true awareness that really sets you up for this false narrative. And then your behavior is shaped by that. And so they get, oh, you know, that's the kid with autism, you know, or, oh, that's the kid with this, or that's the kid with that, instead of just realizing this person has a name, you know, this person has a name, you know, and it just needs to be about the person and seeing the potential and all the ways that they can move your culture and your schools to a better place. So before my son went to the school he's at now, there were a lot of no's. Oh no, we don't know how to deal with autism. We don't know how to do that. And I said, statistically speaking, I guarantee you have somebody, if not more than somebody here with autism. You just probably don't know it because parents are forced, unfortunately, to hide those things, those invisible disabilities, because they want their child to be included, instead of realizing that it's a learning opportunity and a way to teach people humility and compassion and all the wonderful things that come with inclusion. And so the school he's at now actually includes him. They welcomed him with open arms. They wanted to learn. And that was really, you know, unusual because that's not what I had experienced previously. And so for me, I'm always trying to help my daughter. You know, she wrote the book. She wants other kids to understand there are a million differences in the world, and that it makes you better to know those differences and to include them and learn and embrace and welcome someone.
Okay, I'm just trying to write down some notes as you're talking.
No worries.
Okay. All right. Is there anything else you'd like to add to that?
I think just kind of what I said, and I said this in my public comment too at IACC, is I think you're seeing oftentimes people think that we're a culture that needs rescuing when we're not. we're a people who are very resilient, very strong, and we want to be partners in creating systems that are effective and matter. We don't want to be served. We want to be part of building service structures.
Wow, very powerful words there. I got chills.
Thank you.
Okay, so let's move on to the next question. What services for employment for people with disabilities come from inside your tribe?
So there's quite a bit, actually. You know, because they have such infrastructure more than just like the tribal service centers and stuff. They have businesses and of various kinds, meat packing plants, PPE, you know, factories. So there's jobs there's quite an array, I would say, of job types. And so that allows for various skill sets, whether you're in a wheelchair, whether you know, need other accommodations. And I think there's a lot of opportunity for employment. The one thing that I think everyone still needs to continue to do is to change their perception of inclusion and hiring, and to think about how many ways their agency can benefit from being truly inclusive, not just stamping it on your application that you are.
Okay, let's go to the next question. What changes would you like to see made within your tribe or others that would result in improved services, programs to assist people with disabilities who live in Indian country?
So I think one of the key things is that representation matters. And I am talking about more than being a token on someone's board or someone's group. If we have all of these services and systems and laws and policies and statutes and all this stuff for many, many years, federally and in states and in even, you know, local communities, start including your partner as a true partner. I think that's number one, because then we can have better services for everyone. I think the other thing is to start having those critical conversations and those tough conversations internally of disability. And it's okay to ask, it's okay to talk about it, it's okay to show it, it's okay to include it. I think is really important.
Okay. All right, the next question. What suggestions or recommendations do you have that would improve communication and collaboration among federal, state, tribal governments on issues that would improve support and services to people with disabilities in Indian country?
I think obviously the toolkit is a huge first step, I think, but also intersecting it on a any way you can. So for example, we're working on this tribal kit, but there's also like SAMHSA has tribal documents, but they're all disconnected. And if there's one way to uniform, like just kind of the mission, I think would be a good thing, is we want to include, we want to be partners. I think that's the mission that has to come out of this, is true partnership. Like I said, we don't want to be there kind of with our hand out like, okay, how are you going to fix us? Because that's not appropriate. It needs to be, let's join arms and walk this path together and figure out the best way to help one another. I think that's what needs to happen, is those folks need to feel like they're true partners, number one. And there needs to be true opportunities for inclusive partnership, instead of, oh, well, we talked to one tribe and one tribe is like all tribes, right? You know, that kind of thing.
You mentioned SAMHSA. Is that an organization? Or?
Yeah, it's the Federal Substance Abuse Mental Health Administration. And they put out like research, grants. They have a whole tribal document on mental health, but it hasn't been updated in a long time.
Could you send us the link to that? Because that sounds...
Yeah, I'll look for it again. I'll send it. But yeah, I mean, so that was one of my questions. I pulled that open. I'm like, I think the last time it was updated, I want to say it was 2017. And I'm like, okay, it's 2021. A lot has happened. And again, they're kind of the, yeah, there you go. They're kind of the go-to, right, for mental health and substance abuse kind of guidance and trainings and those types of things on a large scale. And if their little tiny tribal section is super outdated, then that's a problem.
Yeah.
If I may add to this, hi,
Hi.
Dr. Hernandez. I was taking a walk, so I just came in as is.
No worries.
I found in my research for the toolkit that you're absolutely right. It is so fragmented. I can research a topic for a week, and then a month later, I'll find some other report and I'll be like, that would have been so helpful. Like, it's disconnected. It's everywhere.
It's everywhere.
Across different governmental agencies, nonprofits. I mean, it is. And then the government provides demonstration grants for 5 years. So there'll be this organization that supports tribal communities nationwide for 5 years, do fantastic work, and then it just completely
goes away.
And we got to start all over from scratch.
Yeah.
So my question is, like, well, let me add one more thing. Another observation is that I've read some letters that like the people who are on the Indian Health Services Board, you know, they submitted a letter to our congressional leaders saying this is how you can support our communities. I've read a couple of letters from different organizations like that. And it just based on my knowledge so far, they're spot on when they recognize the strengths of tribal communities and how there are these governmental barriers that are ridiculous. Like, they're just serving no purpose, but except it makes it much harder. So my question is, how does the leadership in Indian country create the kind of momentum or impact to actually change these things? That is, to me, that's one of the biggest barriers.
So the problem is that you have tribal nations with different types of situations and different levels of need, different levels of power, different levels of service, you know, and that comes from, you know, whether they're gaming, they're not gaming, they have other business infrastructure, not, you know, the size of their people, those types of things. The state they're in matters. Some are public law 280 states, some are not. And so I think what has tended to happen is they go to the largest tribes and they try to partner with them, but then they miss all of the people who are living in shacks, who don't have, you know, very much in their communities, and it's a 3-hour, you know, walk or ride to get down to, you know, school or you know. So I think that's one thing that oftentimes happens. And then, like you said, just the disconnect. It's like, this is a great idea, let's fund it. Okay, we're done funding it, and then it just stops. And so I think there has to be a contingency plan. There has to be a way to continue efforts forward and tie. And instead of creating all these new little things, oh, that's cool, let's do this. Oh, that's cool, let's do this. It should be a continuous flow of, yes, this is great, we need to focus on this, but how can we tie it to the next thing so that there's a continuity of effort and focus. And I think the focus and the issues haven't changed. And they're the same. So it's like decades and decades later, how do we continue a continuous effort? Because there's never been one. It's always been a flash in the pan kind of, this is cool right now, let's fund this, then we stop, and then no one looks at it again for 5 years.
So could the National Congress, what's it?
National Indian Congress of Indians?
Yeah. Could they, I mean, because they're a collective organization nationwide, could they?
I think they definitely could be involved.
Because what we're talking about is policy change at the federal level.
Mm-hmm. Policy change and it's not because everybody wants more money. I understand that. It's not necessarily that. It's just the structure of how you're funding the things. It needs to be a continuous, inclusive effort instead of, oh, let everyone apply. Well, again, it goes back to those with resources are the ones who are going to apply for the resources, and the ones without resources don't have the resources to apply. So it's just kind of those things. It's just, we have to do better in the way that we structure these things.
I saw one example where the tribes in Southern California got really organized and worked with a rural transportation entity, whatever it's called.
Mhm.
And so they created all those meaningful partnerships and created a rural transportation system that seemed pretty effective. And this report I read, had all the, like, everybody who received a dime was on that chart. And you could see how the money was distributed and that they had a strategic plan with indicators, short-term and long-term. Like, it was really well thought out. And it seemed like on a national level, that's what is needed, because I'm working on the vocational rehab chapter right now, and a tribe can receive VR money for 5 years, 4 or 5 years, and then it's gone, and they may not get it back.
Mhm.
And then this other tribe receives money and they're starting from scratch. Like, that is ridiculous.
Yeah.
It's harmful to people.
Mhm. Yeah, and it just goes back to, I know people who don't even have internet in their Indian land, and you need internet to apply for a grant for internet, and so, it's skewed.
Well, when you talked about the poverty of disability, I had heard that, not that term, but that definition, like you need resources to garner resources before.
Yeah.
I think it's in the original toolkit, actually, but that's so true.
Mhm.
So yeah. Okay. I'll stop asking questions. I was just wondering, because really so many of the barriers come from, I think, from our federal government.
A lot of them do, and then some states create barriers.
Yeah.
Yeah.
I'm sorry to interrupt, Desiree.
No, I think this is good. I think this is a really great, fruitful conversation that we're having here, and thank you for your questions. Did you guys want to add anything to that question or answers? Okay. All right, then we'll go ahead and go back to the question.
Okay.
This is actually the last question. So I think you mentioned this earlier also. What is one positive action, event, activity that you see happening in the AI/AN disability community currently happening?
I think we're starting to see more community funding opportunities for, and again, you go to the communities, that's where the providers and the healers and all those folks are trusted and more likely to be utilized appropriately and be available. And so I think we're starting to see more funding come down through them. The one thing that I think we still need to work on is getting reimbursement and honor for these culturally rooted providers of various types. And that's not happening yet, but one day, hopefully. And I think the other thing is that people are starting to recognize that the tribes are partners instead of people that needed to be rescued, and taking from the system and realizing how much they contribute to the system, I think is starting to happen, and it's important.
I have a quick question. Since there's so much attention these days on diversity, equity, inclusion, which is so important, I'm wondering how we leverage that, people's attention on that lens. First of all, they need to be educated about it further. How does one leverage that kind of current climate to
so I think this
issues?
toolkit's one kind of effort, but I think it's really about having representation. So seeing people who look like you in important places that make decisions that impact you. I think it starts there with again, moving away from tokenism and moving into true partnerships is definitely a thing we need to see. But it starts early on. I mean, this starts in, early school, is teaching people about what that actually means instead of having it be, webinar or a mandate as they're adults, you know, because they're already set in their ways in a lot of ways. And you're not going to see them truly embody what the spirit of DEI actually is. You're going to see them follow along with what they think they need to do. But it needs to start early. We should be having DEI conversations in kindergarten, in school kind of forums, and not to overburden them, but just to start planting those seeds, of what it truly means to include somebody, what it truly means, and what equity actually means, and it's kind of like, like why my daughter wrote her little book about her brother's autism, is just for her, she gets asked, like, why does your brother repeat himself? Why is he staying on his tippy toes? Why, and so she created this because she wants them to understand, like, this is just another way to be human, and it's not anything that needs, to be labeled or judged or excluded or feared or whatever. It's just another way to be a human. And there's so many ways that we all have, and so I think it's, again, those conversations early are really important.
Do you think the toolkit needs something about intersectionality?
It could benefit from that.
Do you know where? Where would you put it? In the introduction?
I would put it close to the introduction. Yeah.
I'm thinking about your son, for example. I mean, he's a person with a disability, and he's, sorry, I missed the beginning of the conversation. Are you from the Navajo Nation?
Cherokee.
Cherokee. Okay, so he's Cherokee and he has a disability. I mean, that's sort of like two areas that are ripe for prejudice, right? That there's an intersection there. So just wonder if we should include that. I was reading some stats about from SAMHSA about substance use and mental prevalence and mental health issues and things. And in this one report I read, they referred to American Indian, Alaska Natives who are gay, bi, transsexual, and as two-spirit people, right? And so there's another intersection, right? So it just seems like for it to be current, this is the conversation happening internationally, and maybe we should include something like that.
It is. It's definitely timely.
All right, well, that wraps up my questions. Robin, was there anything you wanted to add, or any other questions you wanted to ask?
You've seen the toolkit, so each chapter has a quote from someone. Is there a chapter where you see yourself, where these?
I mean, I think the quote that I gave you that gave you chills, I think that would be good for maybe the advocacy area.
Oh, yeah, that's good.
I mean, I think that's kind of a good thing there so people, because people always come with I don't need anybody to help me. I don't trust them, this, that, and the other, or the systems don't teach them how to have a voice or make them believe that they don't have a voice. And so I think it's really important. The other areas obviously is mental health, whatever you see fit.
Not education.
I mean, you could do that too, wherever you want.
No, I think your idea about advocacy, that's a good one, because then we could combine the idea of the poverty of disability also with the need for representation and being true partners. Like all of that would fit nicely before advocacy.
Yeah. Perfect.
Well, thank you. I want to say thank you for the feedback too. I am, as I receive feedback and revise things, Desiree, is there a process for them for the panel to then review the subsequent revisions?
No, not in this timeline, unfortunately.
Okay. So well taken, your feedback, and I appreciate the time you spent going through the toolkit. That was
You bet. Well,
very
thank you. Have a good day, ladies.